Hello, this is Brandon Barajas and I'm going to cover allergic reactions for my medical video. Things I'm going to cover today are common allergens, signs and symptoms, both minor and major, signs and symptoms of an allergic reaction, the actions you take for mild and severe reactions, as well as how to use an EpiPen. During this presentation, I will also incorporate the aspects of GDBA that are required and that we should be doing while tending to any medical emergency. So, first of all, when you arrive on scene, the very first thing we always do with any scene, we make sure it's safe. Make sure the scene is safe. Next, get some protective gear on. It could be glasses, could be a mask, could be gloves, whatever you think is needed for that particular situation. Let's address that. We move on to, I'll explain what the common allergens are. Basically, your common allergens are something such as a bee sting, or let's say the client or patient ingests some type of food that they're allergic to. Most commonly, they're going to ingest some type of nut, shellfish, eggs, that kind of item. Again, I will cover mild and severe allergic reactions. The first I will cover is mild reactions. What are some mild reactions that we're going to have? Some of the mild reactions allergic reactions that you'll have is a stuffy nose, itchy, watery eyes, itchy skin, and bumps or rash type hives that will show up from your body trying to fight whatever that allergen is that's in their body that they're allergic to. Those are the mild reactions. Severe reactions, what are those going to be? Those are going to be trouble breathing, swelling along the face, swelling of the lips, swelling of the tongue, swelling of the throat. Those are the things that are going to cause that trouble breathing. That's the major stuff, the more severe type reactions that we want to prevent, and that once we treat them, we hope they go down. The next thing we're going to do prior to treating those items, we're going to get 911 involved. We're going to dial 911, get medical rolling our way. Whether you're at a CC, out in the field, you got to do that. You got to get that going on. That's kind of the secondary assessment as far as you move on to the secondary assessment after you dial 911. So let's go over some of the acronyms that we're going to use during an allergic reaction. One of the major ones is SAMPLE. Obviously, we're going to look for signs and symptoms. Those signs and symptoms I've already mentioned, whether they be mild or severe, what they're allergic to. M, medications, what are we going to give them? That goes into the next topic of actions that we take to treat a mild and severe allergic reaction. How are we going to treat that mild reaction? Well, we're going to treat it with some Benadryl, any type of over-the-counter drug, Claritin, Allegra. Could also be something as simple as soap and water, mild soap and water. The client gets a bee sting, or if the patient gets a bee sting, and we're just going to soap and water that area, try and get the swelling down, maybe a little ice pack or something. That's how we're going to treat it. Those are the medications. How do we treat a severe reaction? Treating a severe reaction, we're going to go along the lines of what's called epinephrine. We come to use an EpiPen. Most people that are allergic to nuts, shellfish, that food stuff, bee stings, they're already going to know it. They're going to have an EpiPen. More often than not, the client that we are protecting knows their allergies, knows that they're going to have that allergic reaction, which could cause those severe items, trouble breathing, swelling of the tongue and face, so on and so forth. They're going to have that prescribed to them. That's where it becomes important as part of SAMPLE to have that past pertinent history on what the reactions are. And just to get them out of the way, the L, last oral intake, and E, the events leading to the injury or incident, to the allergic reaction. What led them? Did they get stung by a bee? Did they ingest shellfish by accident at dinner? Did they eat a piece of banana nut bread and someone just told them it was banana bread? We don't know. So you got to find those things out. Moving on, how do we treat that? We treat it with the epinephrine pen, the EpiPen. There's two types of treatment to administer epinephrine. There's an EpiPen, and then there's also what's called an AVQ. An AVQ is just it's basically epinephrine in a different, it comes in a triangular rectangular shaped dispenser, and it's dispensed almost the same way as an EpiPen, but I'm just going to explain the EpiPen. So, EpiPen, you take it out. It'll usually come in a container such as this. Inside of this is the epinephrine, and basically what the epinephrine does is it counteracts that allergen that's going into the body, whether it be a bee sting or ingested. As I mentioned, the severe reactions, the trouble breathing, this is going to hopefully help stop that. How do we use an EpiPen? Basically, the EpiPen has two ends. One end is just a cap. Both ends have a cap, but the first thing you're gonna do is you're gonna remove the cap at both ends. As you can see here, if I were to remove this whole blue cap, the end would be red. At the end of the red cap is a needle. It's about 1 inch long, and basically to use this, to administer the epinephrine, all we do is remove both caps. We grip it tightly like this. You never put your thumb over the end because that needle comes out. If your hand happens to be over the wrong end because you're rushing and trying to do this quick, that you could have your hand over that needle and the needle goes through you, and now we have another injury and the medicine's not administered to the patient. We don't want that to happen. You grip it tight like this, you take it and you shove it into the meaty portion of the leg. So it's going to be, you don't want to do it on the top, you kind of do it on the side, but it goes in at a 90-degree angle. You hold it there for 10 seconds and count out loud. Just like when you're doing chest compressions, you're going to count out loud for 10 seconds. After the 10 seconds is up, you remove it, cover the cap because it is going to have an exposed needle. You want to dispose of that properly. But once that epinephrine is administered into the skin, then you rub that same area for 10 seconds. What that does is it spreads the epinephrine into the muscle and gets it into your blood vessels. What are we doing here? We're treating anaphylactic shock. What is anaphylactic shock? Basically, anaphylactic shock is when this allergen goes into your body releases a histamine. The histamine is what protects your body from the allergen. The histamine basically opens up the smooth muscle tissue. Smooth muscle tissue is different than the muscles in your arms, heart, legs. Totally different. The smooth muscle tissue is found in your blood vessels. It's found in your digestive tract as well as your lungs, that type of area. That's what causes the severe reactions. The blood vessels in the lungs and the digestive tract seem to swell open, causing the blood to flow. Your heart rate goes up because it's pumping more blood through there. The blood pressure goes down dramatically because the blood vessel is so wide. What we want to do with the epinephrine, it causes the blood vessels to constrict, therefore allowing you to breathe easier. The heart rate comes down, so on and so forth. It treats that smooth muscle tissue. The epinephrine is basically an antihistamine. You have a histamine that helps your body. Antihistamine relaxes that histamine because you're having an over-exaggerated reaction to whatever allergen is in your body. So, we're done with the epinephrine. Then we maintain and monitor the patient until 911 arrives. Once they arrive, we turn it over to them and they handle the rest of it. Now, as far as GDBA goes, once we've done the treatment, we have to do our notifications. Always remember, any medical emergency, anytime 911 is called, you have to initiate a CERT. Once that CERT's initiated and all the leadership is notified, then we have to do our proper reporting of that. You must complete a supplemental report during any medical case, any medical emergency, anytime 911 is called. You cover all those bases and you'll be good to go. Hopefully this helped. Thank you very much for your time and have a great day.